This is Sayyid Hamza Hussain and welcome to Pakistan Cardiac Super League Season 2, presented by Pakistan Cardiac Society and powered by Wilson's Pharmaceutical. Today we are live for the last match of group stages, which is between P.I.C Warriors from Peshawar and JINNAH Eagles from Lahore. And with this, allow me to introduce the expert faculty members who have joined us today with their who have blessed us today with their presence. We have with us the match umpire Professor Mohammad Ishaq Saab, and we also have with us the second match umpire Dr. Suhail Khan Saab. He is professor of cardiology at Queen Elizabeth Hospital, Birmingham. And we also have with us the third umpire Dr. Abdul Hamid Siddiqui Saab. He is former professor of cardiology at P.I.C Rawalpindi. And from the guest panelists, we have with us Professor Hafizullah Saab. Professor Hafizullah Saab is a very renowned cardiologist, and he is currently serving as a chairman of the board of governors at P.I.C Peshawar. And we have also with us Professor Ahmed Fawad Saab. Professor Ahmed Fawad Saab is Professor of Cardiology and Head of Department and Director Cath Lab at Northwest Hospital Peshawar. Welcome, sir. And we have also with us Brigadier Zahoor Khattak Saab. He is Professor of Cardiology at P.I.C Rawalpindi. And we also have with us Professor Abdul Rashid Saab. He is General Secretary of Pakistan Hypertension League and Professor of Cardiology. And we also have with us Professor Javed Akbar Syal. He is immediate past president of Pakistan Cardiac Society, and he is professor of cardiology and executive director at SACBT Karachi. And last but not the least, I would introduce the moderator of this program, Dr. Hamza Ghori Saab. He is serving as assistant professor of cardiology at RSC Rawalpindi, and I will now hand over the mic towards Dr. Hamza Ghori Saab to start the formal proceeding of this match.
So thank you very much, Hamza. We are back again with the second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. As you all know, as explained by Hamza already, that this is the last league game of this season. And we have the two teams up against each other. We have Peshawar Institute of Cardiology Warriors versus JINNAH Eagles. So let's see, we are all hoping for a good game today, as we have seen so many wonderful close games this season. With this, I also have the opportunity of welcome today our highly esteemed panel, and it's a star-studded show for everyone. We have amongst ourselves, we have Professor Hafizullah Saab. So it's great to have you on the show once again. We have Professor Ahmed Fawad. We have Professor Abdul Rashid Saab. So it's great to have you. We also have Brigadier Zahoor Khattak. He's with us, and Dr. Javed Akbar Syal. So I think we'll have more panelists hopefully down the line. And we have Professor Abidullah Saab. He's with us, as I can see him there. So welcome, sir, and welcome to you on this last league game. And last but definitely not the least, it's our umpires who keep the match intact. And as usual, it is Professor Ishaq Saab. He's the life of the show. He's always been there to guide us. With him we have, it's really exciting to have Dr. Suhail Khan from UK. So welcome to the show. Great to have you. And Dr. Abdul Hamid Siddiqui, he's been instrumental in quite a few of our games. So with this, I will now move towards the match. And I'm going to randomly ask one of the teams to give the introductions. So the captain is going to introduce the team, and we have P.I.C Warriors, the captain, to please start with the introduction.
Hello, Assalamu alaikum. This is me, Dr. Usman Khanzeb, the captain of P.I.C Warriors of Cardiac Super League. To the right, this is Dr. Wali Salim. He is a third year PGR cardiology. And to the left, Dr. Ataul Wadud. This is second year PGR cardiology along with us.
Thank you very much and best of luck for the game today. We now have Jinnah Eagles, and can we have the introductions? The captain of Jinnah Eagles.
Assalamualaikum. My name is Dr. Hinna. Hello.
Yes, we can hear you. Please go ahead.
Assalamualaikum.
Walaikum assalam.
My name is Dr. Hinna, captain of the team Jinnah Eagles. And on my right, Dr. Yilmaz. And on my left is Dr. Aima and Dr. Nimra.
All right, so welcome to the show and best of luck for the game today. As we all know, it's quite a sunny weather today, and we know that the runs are being compiled in cricket matches these days as we have Pakistan versus Bangladesh going on, and I hope that it's going to be a high scoring game today. And I'm going to move towards the all important toss, which is going to be electronically done. So can we have the coin? All right, so I'm going to randomly ask one of the teams, Jinnah Eagles, to call it, please. Heads or tails? All right, heads has been called. Roll it. And it's tails. So the news is P.I.C Warriors have won the toss. So I'm going to pose you with two questions. First one, do you want to throw the questions or you want to take the questions?
We want to take the question.
All right, they want to take the questions. And the second part of the questions, which case scenario are you going to choose? Case A or case B?
B, sir.
Okay, so the news is P.I.C Warriors have won the toss. They want to take the questions, and the scenario that they've chosen is case B. All right then, let the games begin. Can we have the scenario B on your screen? And I will request Jinnah Eagles to read it, please.
Excuse me, there is network issue here. So
Okay.
we can't see the scenario.
Okay, so you can't see the slide? All right, I'll ask the technical team to help us
So
with
there is
this.
difficulty in hearing and we can't see the screen, no scenario, nothing.
Okay, I think they're having an internet problem, network problem at the moment. So do we have? Okay, so what I can do is I can read it, and then the team, I'll give them enough time to recoup. So case B, a 35-year-old lady presented to the ER with complaints of palpitations and dyspnea at rest for the last 2 hours. On examination, she is anxious with a heart rate of 140 per minute, irregularly irregular. Blood pressure is 84 by 55 millimeter of mercury. On chest examination, it revealed bilateral lower zone crepitations. The rhythm strip shows atrial fibrillation. All right, so I'm going to give you a couple of seconds to recoup, and once you're ready, we'll head towards the first question.
Sir, we are ready.
All right, bring the first question on the screen, please. Okay, so are you able to read this one? Jinnah Eagles?
No sir, we can't see and read.
Okay,
No sir, it's not well here.
all right, so I think our technical team is on it, so I am going to read the first question in the interest of time to move on. So question number 1. What I will request the teams to stay quiet or either keep their mics on mute, and once I'm done with the question, I've read it, then you can start the discussion. All right, question number 1. What is the next most appropriate step? Option A, beta blockers. Option B, calcium channel blockers. Option C, electrical cardioversion. Option D, chemical cardioversion. And option E, inotropic support. And your 60 seconds start now.
Sir, option C, electrical cardioversion.
Okay, that was quick. Are you sure? You've come down the wicket going for a big 6.
Yes, sir.
Okay, option C. Right?
Yes.
Electrical cardioversion, option C, Charlie, lock it. Yes! And that's a huge 6. It's a straight drive for a 6. Very well played. Well done. Right answer goes for a 6. That's a good start. Well done. Now, moving to the second question. For electrical cardioversion of this patient, which of the following will be most appropriate? Option A, synchronized monophasic shock. Option B, unsynchronized monophasic shock. Option C, synchronized biphasic shock. Option D, unsynchronized biphasic shock. E, none of the above. 60 seconds on your screen.
Sir, option C, synchronized biphasic shock. Option C, sir, synchronized biphasic shock.
Okay, so are you sure? Option C, synchronized biphasic shock. You're here for a T20 match for sure. All right, so I'm going to lock Charlie again. Option C. Yes! Another one for a 6. Very well done. Very well done. I think they'll have to bowl tighter to avoid the 6s. Anyhow, very well done. So moving on to question number 3. So do we have the team back? Jinnah Eagles, do you have the question on the screen?
We have the question on the phone.
Okay, so please read the question.
Question 3. The success of cardioversion is influenced by all of the factors except alpha, left atrial size, beta, chest wall impedance, Charlie, duration of AFib, delta, rate of AFib, and eta, monophasic versus biphasic waveform of the shock.
And the timer starts now. 60 seconds.
Except oil is size, we know.
What about duration?
About duration, exactly. D. Sir, option D, rate of atrial fibrillation.
Okay, so option D, rate of atrial fibrillation. Are you sure?
Yes, sir.
Okay, they are sure. Lock delta, option D. Oh yes, that's a hat trick of 6s. Very well done, well played. I think very nicely answered and well done. So, 3 6s in a row. Moving to question number 4 on your screen. Read it, please.
Question 4. Following synchronized DC cardioversion is achieved. A detailed examination reveals a mid-diastolic rumbling murmur at the apex. Which of the following will not be a sign of severe mitral stenosis? Alpha, loud S1, beta, soft S1, Charlie, long A2 OS interval, delta, short A2 OS interval, eta, loud P2.
All right, the timer starts now.
Long A2 OS. Lock. Sir, option C, long A2 OS interval.
Okay. So, which option? Say it again, please. Couldn't hear you.
Option C, sir.
Option
Charlie.
C. Option C, Charlie. Long A2. All right. An OS interval. Lock Charlie. Option C. Oh, yes. Nicely done. You know the clinicals. You know your clinicals. Very nicely answered. Very good job. So that's the fourth right answer in a row. Well done. Do we have history in the making? We'll see. Moving to question number 5.
Question number 5. Auscultation of the left sternal border reveals the classical Gram-scale murmur. What is the description of said murmur? Alpha, high-pitched decrescendo diastolic murmur. Beta, low-pitched decrescendo diastolic murmur. Charlie, high-pitched decrescendo systolic murmur. Delta, low-pitched decrescendo systolic murmur. And eta, high-pitched crescendo diastolic murmur.
the gram steel PR the nakam yo the low pitch देखो low pitch خودی دون هما تا पता دا خوشی diastolic थी और diastolic थी सही शो कर low pitch Sir, option B, low pitch decrescendo diastolic murmur.
Okay, so option D, delta, right?
No, B, sir, beta,
Okay,
beta.
B, beta. All right, low pitched decrescendo diastolic murmur. Option B, right. Lock option B, beta. Oh, that's the first miss. All right, so the first one that has been missed today, question number 5. Never mind, you've done very well so far. And moving to the next question, which is question number 6.
In a patient with MS and atrial fibrillation with the following beta pulsus paradoxus, Charlie pulsus deficit, beta pulsus parvus, eta pulsus bisferiens.
And the timer starts now.
Yes, sir, option C, pulses deficit.
Okay, so option C. Have again come down the wicket. Pulsus deficit. Dr. Ishaq would not be happy. You want me to lock it?
Yes.
Okay. They want me to lock C, pulsus deficit. Lock C, Charlie. Oh, yes. That's the right one. Well played. That's nicely played. A 6 for sure. Well done. So now we have question number 7. Read it, please.
You decide to do an echocardiogram that left atrium regarding entry for
Sir, voice is not clear, sir.
underestimate mitral area.
Okay, so
Sir,
can you?
voice is not clear, sir.
All right. So I'll read it for you. Hold on, I'll read it for you. But I think you can read the question, right?
Yes, sir, we can read.
Okay, so the question number 7 is: you decide to do an echocardiogram that shows thickened mitral valve and dilated left atrium. Regarding planimetry for the assessment of mitral valve area, which of the following is true? Option A: high gain settings underestimate mitral valve area. Option B: high gain settings overestimate mitral valve area. Option C is planimetry is dependent on transmitral flow. Option D: planimetry is inappropriate for assessment of mitral valve area after PTMC. And option E: heavily calcified leaflets lead to overestimation of mitral valve area by planimetry. And the timer starts now.
Option A is high gain. Heavy calcified lead to overestimate. B to E.
25
E.
seconds. 20 seconds.
Okay, depending on transmittal flows.
It's a tricky one. Let's see. How well do you do the echoes? 9 seconds. Come on.
Option E, sir. Epsilon.
Okay, they want us to lock option E, epsilon. All right. Lock option E. Oh, all right. That's the second miss of the day. All right. So this is what we have. Echoes are extremely important. And with this, we now move to question number 8 on your screen. So, do we have Jinnah Eagles? Can they still read it? Can we hear them well?
So you can see question number 8. For assessment of suitability for PTMC, you proceed with Wilkins score. All of the following are parameters of the score except alpha, leaflet mobility, beta, leaflet thickness, Charlie, subvalvular calcification, delta, leaflet calcification, eta, subvalvular thickening.
And 60 seconds on your screen.
Mobility stuff, thickness stuff, lip calcification
subvalvular
subvalvular thickening stuff. I think calcification is leaflet calcification, subvalvular nishta.
So that's a straight delivery, I think. Let's see how they play it.
Sir, option C, subvalvular calcification.
Are you sure it's option C?
Yes.
You want me to lock it?
Yes.
Okay. C, Charlie. Lock option C. Yes. That's been pulled for a huge 6. And that's what we were expecting. Well played. Very well done. Very well done. So we do have Professor Fawad Farooq Saab. Great to have you on the show. A great panel that awaits us. And with this, we move to the second last question of the day, in fact, of the innings, the first innings, and that's question number 9 on your screen. Eagles, can you read it?
Sir, we don't have question number 9 and it's not visible on our screen.
Okay, so this technical glitch is persisting, I think, so I'm going to read it myself. Question number 9. The patient's echo shows mitral stenosis with mitral valve area of 1.02 centimeter square by planimetry and a Wilkins score of 7. A decision to proceed with PTMC is made. What will be the appropriate size of the balloon for this patient given the patient's height is 160 centimeters? Option A, 22 mm. Option B, 24 mm. Option C, 26 mm. Option D, 28 mm. And option E, 30 mm. 60 seconds, start now.
Option C, sir, 26 mm.
Okay. You want me to lock Charlie option C?
Yes, sir.
Are you sure?
Yes.
Is this going for a 6?
Hopefully, sir.
Let's see. Lock Charlie option C. Yes, it's going for a 6. Well done. Very well played. So I think you are doing your PTMCs and you are observing them. You know the formulas. Good job. With this, I move to the last question of the innings, question number 10. And I'm going to read it myself. The patient undergoes PTMC and the pressure tracings show the following waveform. Which of the following is true? A. Okay, you can see the picture, we can show it afterwards as well. All right. So I'm going to continue with the options. Option A, a patient has developed acute severe MR. Option B, the patient has no evidence of mitral regurgitation on pressure tracings. Option C, the mean transmitral gradients are reduced. Option D, both A and C. Option E, both B and C, and the 60 seconds start now. Put the tracing back.
برا دي كان غدا شبيبي.
Can you show the tracing again, please?
Show the tracing, please.
MR KD वाला पढ़ी दे से
25 seconds.
Okay, sir.
20 seconds. Come on. Approaching 10 seconds now.
Sir, option D, sir, both A and C.
Option D, Delta, both A and C. All right. So you want me to lock it? Fine. Lock option D. Let's see. Oh! That was a Yorker, came in and it's been missed, all right. So that concludes the first session, the first innings by P.I.C. Warriors. I think it's a reasonable total of 42. They have done well, and I think it's going to be a good fight today. So since we have come to the first half of this match, I'm now going to take the opinion from our umpires, and as we have Professor Ishaq, sir, we'll start with you first.
Thank you, Hamza. Interesting. I got these questions only last night, and I would have thought that they were relatively simple given the previous scenarios. I think P.I.C. was lucky to have a relatively simple scenario and questions, but they did very well, and congratulations to them for a very good score. There has been no technical issues. So I think let's see what the other team does. It was again a very common clinical problem, and decisions have to be made according to the patient's clinical scenario. So I think P.I.C. boys were well updated with their subject, and they did very well. So congratulations to them and their mentors.
Right, sir. Thank you very much for the input. And we also have Professor Hafizullah. Sir, I can see you on the screen. Your thoughts so far?
I think it was a very nicely constructed case, very relevant questions. Sometimes we have questions which are not pertinent to our clinical application. These are all very important questions, and I'm very happy that the team has answered them properly. And this is, I think, a great learning and academic exercise. And I'm very happy the way questions are constructed. Thank you.
Thank you very much, sir, for the input. I think this keeps the whole thing alive and everybody is geared up. And we also have Dr. Suhail Khan from UK. Sir, are you there? He's one of the umpires as well.
Yeah, so really well done to P.I.C. I think they've posted a very good total here. I have to say I was a little bit disappointed that they didn't get question 5 about the Graham Steele murmur. Just to give you a little bit of history, Graham Steele was a physician who qualified from University of Edinburgh. He was the first one to describe the murmur. This is a classical murmur of high velocity across the pulmonary valve. So I'm disappointed they didn't get that. I think in your part of the world, this is a very common clinical scenario. We hardly ever see mitral stenosis in Europe. It is a dying thing in this part of the world, but I would have expected them to have got that. But nonetheless, they've posted a very reasonable total, and I think JINNAH will have their work cut out trying to achieve that, but good luck to both teams.
Thank you very much, sir. It's always great to have you, and thanks for giving us a little insight about the history of this murmur. And we do have Professor Fawad Farooq. Sir, are you there?
Yes, Hamza, I am there. And really, apologies for a prolonged absence because of busy commitments. But really missing this whole activity. Good to see Professor Hafizullah, Professor Ishaq, and seeing Dr. Suhail Khan, Dr. Ahmed Purwad, Dr. Rashid as well, and I'm seeing window of Dr. Zahoor Khatak as well. So some new entries as well. Hamza, just want to know the impact of this match on overall situation because I think it's probably the last match of this group. Can you hear me?
Okay. No, so I think it's in terms of the consequence that it's going to bear. You mean with this, whether
Yes,
this.
who is going to win? If, like PIC has played first inning very well, 42. So what happens if they win and Jinnah lose? If Jinnah wins, who is going to go into the next round out of these three teams?
Right, sir. So Hamza is going to update us very soon. He's on it. So I think we'll know because I think most of the pools were decided already. So he's just going to let us know how this is going to impact all of us. In fact, the course of the
That
game.
will create an excitement regarding if this second
Yes.
inning really means
Yes.
anything to Jinnah Eagle.
Oh, yes.
If they win, what happens? And if they lose, then what happens?
Very right, sir. We'll know shortly.
Over to you, Hamza.
Okay, thank you. So we'll be knowing it shortly and we'll let you know. We have Professor Ahmed Fawad with us. It's a star-studded show today. So, sir, can we have you on screen? Professor Ahmed Fawad, is he there? Okay, so I think he'll have to unmute if he's there. In the meantime, we have Dr. Zahur Khatak, if he can hear us. Okay, Dr. Javed Akbar Sial, is he there? Okay, any one of the panelists? If Dr. Ahmed Fawad is there.
Yes, can you hear me now?
Yes, we can hear you, sir. So great to have you. Your thoughts on the game so far?
Thank you very much for your invitation. Although it was my first time, but it was very interesting to involve PG trainees in a very interesting way. Just a couple of comments. One is if we can show the questions on a bigger slides for the rest of the audience to read it themselves, it will be, of course, much more helpful. Secondly, the content itself was very relevant. That was very great. It was so relevant to our day-to-day practices. However, I would suggest that if we can keep a little bit more standard closer to the CPSP standards, rather than make it very simpler. Although the content was relevant, but I feel that we need to achieve more and more CPSP standards as far as the questions complexity is concerned. The rest of the things are quite great and interesting. Thank you.
Thank you very much, sir, for your input. I think definitely today we had a scenario where things were pretty streamlined. I would say this was basic to say the least. We've had scenarios which were pretty tough and as per standards of CPSP, but we are always evolving with this. I would request all those people who are there to keep your mics on mute unless you're commenting on something. All right, we have Professor Abidullah with us. Is he there?
I think Hamza just want to add one thing. If you want to see the bigger screen, like question screen as a big screen on your computer, you can just pin that, then you'll continuously see that particular screen on your computer. So this option is available.
Yes, very rightly pointed out. You have the option of pinning it. I think in that case, you'll be able to see it much bigger than what you have in front of you. So pinning is the key, and I think the technical team will help everyone over there. So with this, I think we now move towards the second half of the game, and we all know that it's 42. The score is 42 to beat, and Jinnah Eagles, they'll start their innings. And we are now going to move to the center with the scenario on the screen. All right, and I'm going to ask PIC Warriors to read the scenario.
A 25 years old male present
We don't
to
have.
your...
Okay, hold on. There is a problem that Lahore is facing. Jinnah Eagles, you can't see the slide. Jinnah Eagles, can you hear me? Eagles, can you hear me? So, but I can't hear Jinnah Eagles. Can they hear me? Jinnah Eagles, are you there? Okay, so we seem to be having a technical glitch at the moment. We all know how internet is performing these days, and we do apologize for that. So the technical team is on it.
I'm seeing the window of Dr. Abdul Hamid Siddiqui as well. You can take his input.
Yes, yes. So yes, and I think we have Dr. Abdul Hamid Siddiqui, sir. If you can hear us, and Professor Abdul Rashid is also there. We would like to take your comments. Meanwhile, we are settling the issue.
I think very practical and clinical scenario, and the P.I.C warriors has done very well, and this is everyday scenario that these residents do come across in the cath lab, and I think very well done. Let's see what the other team does.
Right.
Fawad, sorry, Hamza?
Yes, sir. Ishaq Saab.
Just a minor comment with respect to Dr. Fawad's observation.
Sir, please go ahead.
Yes. First of all, I would like to welcome him. He joined us for the first time, and he has made very good comment. Let me tell him that since you have not attended the previous sessions, we had quite complex scenarios, quite complex questions, and they were more or less CPSP standard. Rather, some of them were higher than CPSP standard. So, yes, we had quite complex questions in the past as well. So this question was relatively simple, but again, you saw that they could not answer one or two questions correctly. So, but your point is well taken that we should make questions which should be in accordance with the standards of CPSP or any fellowship exam. Thank you.
Thank you very much, sir. So we do have Professor Abdul Rashid with us. Sir, can you hear us? Okay, Okay, hold on.
Can you hear me now?
Okay,
Yes.
so I'll request the teams to stop here because we have Professor Abdul Rashid and we are yet to start officially. So please, let's take the comments. Yes, sir. Professor Abdul Rashid Saab.
Okay. Thank you very much for asking me to invite this in scenario. Actually, I am busy in some other meeting as well. So, but what I have heard, I have seen the first session. It was really marvelous, and they have done excellently well. And I hope the second team will do will try the best. And the questions are excellently good, and they are up to the standard. And I think that when the students are in grade in R2 and R3, they are preparing themselves for the CPS, so they can answer these questions.
Can you hear?
Okay, we can hear you. I will request the teams to hold on, please. I'm coming to you. We have Professor Abdul Rashid who's commenting. Sir, please go ahead.
So, thank you very much again. So, I think that you should continue with this match. Let's see what the second team is doing.
Thank you very much, sir. Thank you very much. It was a pleasure having you. And can we have the teams on the screen now? All right. So, Jinnah Eagles, you can hear it. You can hear us. You can see the screen.
Yes,
all good?
Yes.
I think you've had ample time, and I will request P.I.C warriors to quickly go through the scenario now.
Sir, the second team is not visible.
Okay, you can read the scenario, please.
Okay, sir. 25-year-old male present to your clinic as he is interested in joining the basketball team. He has played basketball since 5th grade and denies any limitations, including chest pain, dyspnea, or lightheadedness. His exercise regime include running, rowing, and lifting weights, all without issues. He does not smoke or use any recreational drugs. His family history is positive for lung cancer in a paternal uncle. Physical examination revealed a heart murmur detected during a routine physical examination. Echocardiogram reveals a thickened LV wall with a septal thickness of 16 mm. His ECG shows a heart rate of 48 beats per minute, left ventricular hypertrophy with deep T wave inversions in the precordial leads. He has no symptoms and a normal blood pressure.
All right, so thank you very much. And can we have the first question on the screen, please? Read the question, please.
What is the most likely diagnosis? A. Hypertrophic cardiomyopathy. B. Athlete's heart. C. LV non-compaction. D. Cardiac amyloidosis. And E. Aortic stenosis.
And the timer starts now. 60 seconds on your screen.
Alpha, hypertrophic cardiomyopathy.
Okay, so you're sure it's alpha?
Yes.
Okay, that means you want me to lock it. And I'm going to lock alpha option A. Lock it, please. Oh, that was an outswinger and you missed it. All right, all right. Well, better luck next time. Question number 2 on your screen.
Which ECG abnormality is not commonly seen on the ECG of the elite endurance athletes? Option A, incomplete LBB. Option B, early repolarization. Option C, increased QRS voltage with diffuse T wave inversions and deep Q waves. Option D, increased P wave amplitude. And option E, incomplete right bundle branch block.
And your 60 seconds start now. Due to internet issues, we are unable to see the other team, which is Jinnah Eagles, but we can hear them. Hopefully, they'll be back as soon as the internet issue is resolved. Approaching 20 seconds. 15 seconds. Come on, Eagles, 10 seconds. 8, 6.
Delta.
Are you
Delta
sure?
Delta increased P wave amplitude. Yes.
Okay, they want us to lock D. Option D, delta. Lock it. Oh my goodness. Second miss in a row. Another outswinger missed. All right, all right. So the margin is getting tighter. You will have to buckle up. And with this, sir.
I think now they can just equalize, can't win. If you go with every right answer after that. Okay,
yes.
Hamza, okay.
Very right, sir. You have to give all the answers correctly. So the total is 42. And the yes. So now they have to be very careful. With this, we move to question number 3.
Most common cause of sudden cardiac death in athletes of all age group. Option A, arrhythmogenic right ventricular cardiomyopathy. Option B, hypertrophic cardiomyopathy. Option C, atherosclerotic cardiovascular disease. Option D, long QT syndrome. And option E, coronary anomalies.
And the timer starts now.
Lock option beta.
Okay, so beta. You want me to lock beta. Hypertrophic cardiomyopathy. All right.
Yes.
So lock beta option B. Oh, 3 missed in a row. My God, and that's a costly miss. Because now you've missed 3 questions in a row, and what you can do is you can only tie. So Dr. Fawad had a wonderful question. He wanted to know the outcome of this match. So sir, the outcome is whosoever wins is going to get to the second stage, the next stage. So this match is extremely crucial. In other words, it's a quarterfinal. That's how I put it. Anyhow, let's see. We still have 7 questions, but you have to nail them down to equalize. Question number 4 on your screen. Best of luck, Eagles.
What findings on the ECG of the athlete raised the suspicion of cardiomyopathy? Option A, corrected QT interval more than 441 millisecond. Option B, T-wave inversion in inferior lateral leads, lead 2, 3, AVF, V5, V6. Option C, T-wave inversion in V1. Option D, relatively short PQ interval of 125 millisecond. And option E, all of the above.
60 seconds on your screen. Jinnah Eagles, come on. If you draw it, that means you come up with all the right answers, you will still qualify. So there is a lot to play for. Approaching 20 seconds. 15 seconds. Come on. 10 seconds. 8. 6. Come on. Answer.
Alpha.
Okay.
Alpha.
I hear A. Alpha. Do you want me to lock it?
Yes.
Okay. Now we have to lock A. Alpha. Lock it and we'll see what happens. Oh my God. That's another wrong answer. 4 in a row. And you had the chance of winning the match first and then equalizing and qualifying. And now we all know the outcome. Well. So with this, I think I will still move to question number 5. But we know the outcome of the game and the leagues. All right, question number 5. Read it, please.
How often should this athlete undergo cardiac screening? Option A, every 6 months. Option B, every 12 months. Option C, every 2 years. Option D, every 5 years. And option E, only if symptoms develop.
60 seconds on your screen. Jinnah Eagles, come on, you still have to fight for your pride.
होता है
20 seconds. 15 seconds. 10 seconds. Come on, we need a 6. Come on. 5, 4.
Charlie.
All right.
Option C, Charlie.
I hear Charlie. Option C. Lock it. Oh my goodness. Oh, that's so that's 5 in a row. Come on, Jinnah. What's going on? Anyhow, 5 more to go. So we have question number 6 on the screen.
Which of the following is a key feature of athlete's heart in comparison to hypertrophic cardiomyopathy? Option A, increased left ventricular wall thickness. Option B, increased LV cavity size. Option C, diastolic dysfunction. Option D, interventricular septal wall ratio to posterior wall of more than 1.3. And option E, all of the above.
60 seconds on your screen.
कैविटी साइज है कैविटी साइज तो कम नहीं होता हार्ट का ज्यादा होता और हुक्का में कम हो रहा होता है हुक्का में कम हो जाता है बताना क्या है ये बताना है कि एथलीट हार्ट को क्या जो इन्होंने इनिशियल पैरामीटर दिए थे सिनेरियो में वहां पे सिर्फ 6 मिलीमीटर का सेप्टम था मेरे ख्याल में कैविटी साइज ही होती है कैविटी साइज है एथलीट हार्ट की कैविटी बड़ी होती है
20 seconds.
कैविटी छोटी होती है आईवीएस से पोस्टीरियर वाल रेशियो भी कर सकते हैं
15 seconds. Come on, Eagles. Less than 10 seconds now. 7, 5.
Beta.
Okay.
Option beta.
All right. They want us to lock option B. Beta. Lock option B. Oh, yes. Finally. First right answer of this innings. Well done. After missing 5 questions, but you can still do it. I can understand this can happen, cardiomyopathy, and it took its toll on you, but still you can have the next few questions going your way, and let's keep the spirit going. After all, it's a learning activity.
For Fawad Farooq.
Sir.
Kufar tuta khuda khuda karke.
Right, sir. So we have the next question, question number 7 on the screen now.
Which of the following is a potential benefit of cardiac MRI in the athletes? Option A, better assessment of left ventricular function. Option B, better assessment of coronary artery disease. Option C, better assessment of cardiac structure. Option D, lead gadolinium enhancement. And option E, all of the above.
The timer starts now. I can see P.I.C. warriors bowling really fast with a lot of confidence. Come on, Eagles. We can't hear JINNAH Eagles. Are they there? "22 seconds. JINNAH Eagles, are you there? 15 seconds. 10 seconds. Come on. 6, 5, 4.
Delta.
Okay. Just at the last few seconds, they come up with option D, Delta. Lock it, please. Another one missed. So that's hostile bowling going on at the moment. That's all I can say. The batsmen are clueless. All right. Question number 8. Read it, please.
Which of the following is not part of 14-element AHA recommendation for a pre-participation cardiovascular screening of competitive sports? Option A, personal history. Option B, family history. Option C, physical examination. Option D, ECG. And option E, none of the above.
60 seconds. Start now.
Participation पहले जो 14 चीजें आपने 14 कोई recommendation
examination all of the above option 9 तो मेरे ख्याल में physical examination
at least for athletes वगैरह इधर उधर ट्रांसफर होते हैं ना सबसे पहले अपना medical examination
तो उसमें physical examination ही आएगा
लेकिन उसमें ECG करते ही हैं
इस पेशेंट की नहीं 14
Seconds. Jinnah Eagles. Come on. 10 seconds.
Ita, none of the above.
Okay, Eagles are saying it's E, none of the above. All right, lock E. Oh, no, no, no. So you've missed question number 8 as well. Only one correct answer so far. Only one correct answer so far. And we're only left with the last 2 questions of this innings. Moving to question number 9.
This same patient on follow-up presented with a history of cardiac arrest requiring brief CPR. What would be the best next step in the management? Option A, ETT. Option B, provocative measures for LVOT gradient. Option C, Holter monitoring. Option D, cardiac MRI. And option E, ICD placement.
And the timer is on your screen. Approaching 20 seconds. Ten seconds, come on. 5 seconds. Answer. 2, 1.
Ita, ICD placement.
Okay, just at the final second, few microseconds, they come up with E, ICD placement. So lock option E. Oh my God. So question 9 again missed as well. So we move to the last question of this innings, and we have it on the screen. Please read the question.
LVOT gradient at rest in this patient was 30 mm mercury, which increased to 100 mm mercury on Valsalva maneuver. Holter monitoring of this patient shows short runs of atrial fibrillation. A Chadwick score of this patient is 0. What would be the most appropriate anticoagulation regime for this patient? Option A, no anticoagulation. Option B, aspirin 325 mg daily. Option C, clopidogrel 75 mg daily. Option D, apexaban 5 mg BD. And option E, aspirin 81 mg daily.
Timer starts now. 60 seconds.
Alpha. Option A, alpha.
Are you sure? You want me to lock it?
Yes.
Okay. They've come down the wicket. They really want to end the game with a huge 6. Option A, no anticoagulation. I'm going to lock option A now. Lock it. Oh no. They were really confident.
Hamza, I've been telling the teams, please consume your time. Think about it carefully. Don't jump to the answer so quickly. And this is what they did.
Very right, sir. You've been telling everyone, guiding everyone to utilize the time. And with this, I'll request the teams to be quiet now because we have now come to the end. So it was an interesting game. P.I.C. Warriors, they put up a score of 42. I'll request JINNAH Eagles to pay attention here. And they responded with a score of 6. Only one correct answer. Well, never mind. It's just a game. But we are all learning here. It did turn out to be a bit disappointing because, you see, we thought maybe they'll give a good fight. And they had, even if they had qualified, even if they had come up with equal score 42, equalized a score of 42, they still had the chances. So, and we were all hoping for a good game. But in the end, it's P.I.C. Warriors who have come on top. And well done to you, commiserations to JINNAH Eagles. And I'm going to move to our panel experts, and we have Professor Ishaq, our umpire, Sir, your thoughts?
Thank you very much. A bit of disappointment on the part of JINNAH. I think athlete's heart is quite a common condition. And after Ashar Nazim winning the gold medal, they should have learned about athlete's heart. So I'm a bit disappointed because today the match was more or less one-sided. And but that's the competition. You can't help it. I hope they will learn from their mistakes, improve their knowledge, and come up with the proper answers. One thing I've been telling them that please, you've got 60 seconds, utilize 60 seconds, and don't jump onto the conclusion so quickly as they did in the last question. Again, both these scenarios were common day-to-day clinical practice scenarios, and one team has done very well, the other team has not done well at all. This is one of the lowest score that we had so far in our tournament, I think. So I think it's a message to JINNAH to improve themselves, and inshallah, they will come up again with better results. There should be no discouragement. It's a learning process, it's a knowledge, and it has to be kept updated. And we learn from these things, so I'm sure they are also learning from their mistakes and good or wrong question answers. So thank you very much. I'll be leaving a bit early, and my regards to all the distinguished colleagues on the panel. And it's always a pleasure to be part of this exercise, academic exercise. And I think all these questions are very relevant and very important questions that have been discussed. Thank you very much.
Thank you very much, sir. It's always great to have you. And yes, it was the second lowest of this season, but I think it's all about learning, and we should never be ashamed of participating, and we always learn, we always improve, and that's what we are striving for. With this, we have Dr. Suhail Khan with us from UK. Sir, are you there?
Yes, so clear win here for P.I.C, so well done to them. I think JINNAH Eagles just didn't turn up to play the game today. I don't think the questions were terribly difficult that they were facing, but I think they should have really have read up about athlete's heart and hypertrophic cardiomyopathy. Well, a couple of interesting observations. I think, I know Professor Ishaq said that they were really quite quick in terms of their answering, but actually they were leaving it really quite late into the wire, which suggests that actually they were struggling to know what the correct answers were. A couple of other observations. So in Greek mythology, remember Icarus, he made wings of wax, and he flew too close to the sun, and his wax melted and he came to destruction. So unfortunately, the Eagles had wings made of wax today. They melted away very, very quickly here, unfortunately. So it was fairly obvious from the outset who was going to win this match. But having said that, it was a good game, and they should go away with their heads held high. Everybody has a bad day, and we've seen this on occasions where people just don't turn up. What you do is you try and make yourself better and come back stronger for the next occasion. Thanks, everyone. Thanks to Wilson's as well for their invitation to attend today. And I hope to see you soon, some of you, hopefully next week, at the ESC in London.
Thank you very much, Dr. Suhail. It's always great to listen to your comments. I think keen observations. And yes, it turned out to be a bit disappointing. But then again, we always learn from our shortcomings, and we're always improving. And with this, I'm going to take comments of our third umpire for the game today, and we have Professor Abdul Hamid Siddiqui. Sir, your comments.
I think the scenario was simple and straightforward, as Professor Suhail mentioned, and looked like that the JINNAH Eagle was not much prepared, but I think failure lead to success. Hopefully they will improve upon and will work hard, and good luck and success in the future for them. So very good clinical VNA on both sides. Good luck for the next future.
Thank you very much, sir, for your comments. And we do have Professor Abidullah. Sir, your thoughts on the game today? Professor Fawad Farooq, sir, are you there?
Yes, sir, I'm here, and I would add something to it because certainly athlete heart is common, but comparing mitral stenosis to athlete heart, so a bit bad luck for JINNAH Eagles. I know their potential. They are finalists of the last series, so they don't have to be this hard because I personally believe in its slightly imbalanced competition in a way. We daily in and out CMS, PTMC, and everything, rather than discussing athlete heart that commonly practically. So that's why I personally believe in when we are making two scenarios for a match in terms of table of specification, how common the problem is in terms of practicality, two scenarios should be linking together. Like, for example, I can say athlete heart and hokum. That's okay. Both are, but MS, a condition very common. And second, when someone is winning the toss, it's not just option A or B. Then we should be giving them the heading of the options as well. Then it really makes difference in terms of winning the toss, whether they're opting for valvular or athlete heart. That's the two technical points I'm adding today, and we'll work on it because Wilson and we all are making these things to make it more, you can say, compatible and less discrepancies and all that. That's my message to JINNAH Eagle. They don't have to be disappointed. I know they are very potentially very well strong team, and hope them to perform well in the next season.
Right, sir. I think some very interesting thoughts. Fawad Saab is always pretty dynamic and innovative, and I think it's an interesting point for the panel and also for the strategic team, because I do believe right now what we are doing we are placing it on chance. We know that we can have these issues. We are placing it totally on chance, and it's an unconscious decision when we ask them. So you want to make it a conscious decision so that the team that wins it has the option of utilizing that advantage in their favor. But then again, I think it's the council which is going to decide. But very important points. I think we can still make it more interesting and more strategic. So that's the whole point of the game. And we also have Professor Zahoor Khattak Saab. Dr. Zahoor, are you there? So you'll have to unmute, sir. I think we can see you there. So we have.
I think Hamza, no one is there. I think we can conclude. We're already late.
Yes, Professor Abdul Rashid. I see him, and then I think if he's there, otherwise we'll call it a day. Okay. So I think that's about it. This was the last league game, and I'm going to do the honors of closing the session. Like always, it was a wonderful game. I think P.I.C. Warriors, they came on top. They performed really well. But JINNAH Eagles, I think there was a lot for them to take home. They can always improve on things, and we wish them all the best for future endeavors and future matches, because they are an extremely important team. We have Dr. Zahoor there.
Please go ahead, whatever you want to say.
I'm sorry, actually, the kid was telling me that he has unmute my...
Okay, now we have Zahoor Saab. Yes, please, yes.
With due respect, I may not agree with Dr. Fawad. Actually, that was a quite balanced. It was not an athlete heart, but the question were very so common. Just like first question, anybody with the heart rate of 48 should not be missed as an athlete heart. His heart rate was 48. That was a big clue for them, and unfortunately, they missed it. The second question was, or the third question was of sudden death. So I think sudden death is very common. We see as a routine, and there is a more discussion on it. Anomalies and long QT and hypertrophic cardiomyopathy. But I think Dr. Sohail Khan is very absolutely right. it was not their day today in this match.
Right, sir. So I think, again, extremely important thoughts. We all agree every scenario is important because you can never have the justification of not having gone through the cases since they are not common.
Yes.
So we all need to go through everything. I think we all agree with you on that account, and so does Professor Fawad and the rest of the panel as well. So with this, I think in the essence of time, I'm going to sign off and thank you very much. I think it's congratulations to all the teams who have participated, and it's victory for everyone, irrespective of whether you proceed to the next stage or you don't, because what actually matters is the participation and the eventual outcome, which is learning, and we keep learning throughout. So with this, I'm now going to sign off. Take care till next time. Allah Hafiz from me and the rest of the team.